All right, Dr. Jake, we're seeing a very unusual case with probably the most high-profile quarterback in professional football, and that's Tom Brady. A third surgery, they're saying now he's responding to antibiotics with the infection. But take us back. He got injured first series of the season. They waited a while to do the surgery. They do the surgery, and now we're looking at a third procedure. That gets some people on edge.
Yeah, it's been interesting following this from where we are here with his injury. The waiting period, which we've kind of talked about a little bit, was probably to see what his medial collateral ligament did. Most of the time that injury will heal itself and doesn't require surgery. So I think they gave it some time to settle down and heal, and if it did, then they wouldn't have to repair it. So my understanding is they reconstructed his ACL. Surgery went fine. Unfortunately, he's got an unusual, very rare infection. They do happen. That's part of surgery. It's a risk of surgery, but extremely rare with this type of surgery. Typically, the infection can be cleared with antibiotics, possibly surgery. Now, he's had 2 surgeries to help clear the infection. That's pretty darn unusual. But it sounds like from the reports from yesterday that they've made progress and they think they've got control of the infection, which is a huge deal as far as the timetable for recovery and rehab, looking at his career. If you can't clear the infection, it usually means you have to go back and actually remove the graft, and which means probably a second surgery down the road here to reconstruct it once they've cleared the infection. So that's a 2 or 3 month delay potentially if they have to go back a third time and take the graft out. It sounds like they've made progress. They're on top of the infection. My understanding is it's going to be intravenous antibiotics for about 6 weeks to make sure they've got it cleared, and then after that they can start the kind of get back on track with the rehab program.
All right, is this just a case of A, bad luck to get hurt, and B, to have this much of a cumbersome recovery?
The getting hurt part, obviously, professional football, it's a tough game, and he kind of an unusual injury the way he got hit. Quarterbacks are obviously pretty susceptible to getting hit like that, but unfortunate, very unfortunate. The infection, like I said, it's less than 1%, extremely rare. Just, you almost have to say a case of bad luck for that, but again, very rare, and hopefully they can get under control with the antibiotics and getting back on track.
Okay, so when he comes back, even though he's had these setbacks, shouldn't really affect him once he is 100% healthy and cleared to play?
Interesting question. Multiple surgeries, things like this in a short period of time, the things you start to worry about are like scar tissue forming and maybe making the knee not quite as functional, range of motion, stiffness, issues like that, kind of chronic pain issues, because the infection itself can be damaging to the joint. The nice smooth cartilage inside the joint, if the infection goes on, can actually damage that over time. So you wonder if he's going to be, how his recovery rehab is going to go here with all these multiple surgeries.
All right, Doc, let's get our attention over to Iowa State. They've had a tough go. Lucas Staiger, this is a kid that can really impact the program. The problem is the impact on his knee has not been good, and he had a kind of a strange development. How do you read that? And again, this is a sensitive subject, so it's mere speculation, I understand, but kind of size up where you think we're at with Lucas Staiger.
Right. From my readings in the paper and online there, it looks like he apparently had surgery 4 years ago on that knee. Not sure exactly what was done at the time. Recently, apparently started developing some issues with the knee. They've, according to reports, they've done an MRI that didn't show anything structurally wrong, but inflammation in the knee. My guess is that he probably rested some. They did some therapy, some rehab with the training staff. Wasn't getting any better, and they didn't have an explanation, and so they felt at this time of the year to go ahead and take a look in there arthroscopically and see if they could fix the problem, make a determination on what was actually going on, and still have enough time to getting back for hopefully most of the season here.
Time will tell on that. They're saying now 3 to 4 weeks. If that's good, then he should be ready for Big 12 season for sure.
It looks like it, based on what the papers are saying, is they didn't find anything significantly structurally wrong in 3 to 4 week recovery here, so that's very encouraging for him. And again, it's second surgery type situation, kind of some chronic underlying pain, inflammation type stuff that hopefully can treat through the training staff and with medication potentially.
Perfect. 5 minutes right on the nose. Hold on a second. I don't erase.